Welcome to Fly to Freedom, the Anorexia Recovery Podcast. This podcast is for you if you're living in a restrictive eating disorder or supporting somebody else. I'm Giulia Suro, your host, an eating disorder recovery coach, and I lived in 40 years of anorexia, orthorexia, and exercise addiction before my recovery journey led me to complete freedom. Wherever you are in your recovery journey, this podcast is for you to help you grow and heal. Let's get on with the episode. Today, I'm really excited to welcome Dr. Giulia Suro to the podcast. Giulia is a psychologist and author in Washington, specializing in the treatment of eating disorders. Additionally, she is a prolific researcher focused on the intersection of eating disorders and trauma. Giulia, welcome to the podcast.
Thank you so much for having me. I'm really excited to be here. I appreciate it.
Oh, it's great to have you on. It's lovely to have a guest episode, actually. I've done a few solo ones recently, so it's really nice to have a guest again. So, okay, I mentioned the quickfire questions. Are you ready for them?
As ready as I can be.
What's your favorite place to walk?
To walk?
Walk.
That's a great question. I have a dog who's been my walking buddy for 10 years. So I feel very lucky to have a walking companion. And I'm also lucky in that I live pretty close to a place called Rock Creek Park in Washington, D.C. It's a little bit like Central Park in New York, but it's bigger and there's some hills. So you can really feel like you're in the woods.
Oh, nice.
And it's less than a mile from my house. So that's I try to fit it in at least once a weekend, a long walk there with Jack.
Oh, what type of dog's Jack?
He is, it's funny, he's a rescue. We thought we were getting a golden retriever, like we found a golden retriever rescue, sort of a diamond in the rough. But he is actually, as he's grown up, he's definitely a mix. He's, I think, part Chow Chow, because he has the black spotted tongue, which sort of developed as he was older. And his fur texture around his ears is a little bit different. So he's just sort of a magical mix of great
and great. How wonderful.
Yes.
Never know quite what you're getting, do you? But love them all the same.
Yes.
What is your favorite season of the year?
I would say fall. I really like this time of year we're sort of getting into right now, mid to late September. Even though I'm not in school anymore, it sort of brings sort of a fresh start. And in addition to the weather, where I live, it's very, very humid in the summer. So getting a break from that, but I just appreciate the chance to sort of reflect and think about the things I want to do in the coming sort of academic year. I like the sort of the back to school season.
No, I hear you.
A forever nerd.
It is a time for reflection though, isn't it? And also just the colors. The colors are incredible.
Yes. Yeah, it's beautiful.
Okay, so what qualities do you most admire in other people?
I think as I've gotten older, and it's really kindness.
Nice.
Being kind is I think it's something we need more of. And when I just observe people being kind under stressful circumstances or when they don't need to, Washington, D.C. is sort of an intense place. So kindness is something that I sort of lights a glimmer of hope in me when I see it in others.
Oh, that's beautiful. And kindness to self as well.
Very much.
Okay. On the subject of kindness, what time is it there right now? Is it really early?
It's 12. It's just lunchtime. 12.
Okay. I can ask this one then. What's the kindest thing you have done for yourself today?
Oh, that's a great question. I took some time. I have a couple of children, and I had an empty house for a few hours this morning. Thought I could get some things done, and I actually just sat and read a novel that I've been craving to dig into. As like for me, that's pure heaven.
Oh, absolutely. It's
Yes.
literally my idea of bliss. That is just
Yes.
to
Yes.
curl up on the sofa, undisturbed, and read.
Yes. I'm with you.
Oh, love that so much. Okay. What's the best piece of advice you think you've ever been given?
That's interesting. This is what's coming to mind. My dad always said anything worth doing is worth doing right. And I think that sort of fueled a bit of perfectionism that wasn't always good, but it really made me believe like just do your best.
Mhm.
And I really took it to mean like you can really do anything you put your mind to. And so if I were to sort of reframe it today, I think that's what it would be, sort of a sentiment of believing in yourself and take a chance on yourself and put your full effort in.
Yeah, absolutely lovely. And my favorite question, which I do ask everybody, if you had a magic wand and can change one thing in the world, what would it be?
That's a great question. And it's interesting times. I would want everyone to have, this is a little bit specific. I would go like the kindness route, like everyone would be sort of more gentle with each other. But if I had to be more specific, I think I would want to grant everyone the peace of mind knowing that they had access to anything they needed to take care of their health, mental health, physical health. They wouldn't have to stress over it financially or finding a provider that could help them. That just everyone sort of had that innate right and access.
What a beautiful answer. Thank you.
Thank you.
Okay, so can you tell us a bit about you, why you do what you do, and what led you to do what you do?
Sure, sure. I'm a clinical psychologist, so I started in graduate school really interested in trauma. I found it to be a very sort of hopeful field. There are these interventions to treat these sort of something external came in and disrupted a life, and there are these interventions that can help people get back to baseline. And so I did a lot of my first work working with veterans in the VA. We have these VA hospitals here, and working with veterans. It's a government organization, like very structured, a lot of constraints. Everyone gets 10 sessions and that's it, things like that. And I thought I would do that. I would be like a professional sort of VA clinician. And I ended up just on a chance doing a small rotation at a residential program for women with eating disorders that was like 2 miles away from my graduate school. I wanted to just mix up my experiences and try something a little bit different. And I really fell in love with that work. I found that as a clinician, I was still carrying a lot of misconceptions and biases about what an eating disorder is, how to treat it, what it looks like. And I thought, like, if I'm a mental health clinician getting a doctorate, like, what does that say about the world? And like,
Absolutely.
these are the people who are lucky enough to get to come to treatment. Like, I think early on, I realized there's just so much suffering. And I also realized, like, so particularly in these higher levels of care, I was working in a residential setting. Many of the women I worked with had really, really severe trauma histories. And like we were treating the trauma was treating the eating disorder, and that their eating disorder was a manifestation of a nervous system gone haywire, a desire to numb, wanting to be in control, and had become its own sort of beast that got the attention of their families and providers. But meanwhile, like the trauma just sort of got neglected. And so I just really became passionate about that intersection.
That's amazing. And I totally hear you. So many people living in an eating disorder have got a background of trauma or unmet childhood needs,
Yes.
or both.
Yes. Yes. Yeah. I hesitate to even use the word trauma. I think it's the best word, but people get sort of in the weeds about what counts as a trauma, what doesn't. And growing up in an emotionally unvalidating environment, having emotional needs not met, these strong attachment deficits, like that is impactful and it is traumatizing. And if you have that predisposition for an eating disorder, it can really swoop in to sort of fill in those deficits.
Absolutely. Could you just clarify what the definition of trauma is for our listeners? Because it's not an event, is it?
No, it certainly doesn't have to be. So if we're talking about a diagnosis of PTSD, which I think there's a lot of flaws with our diagnostic system. It
Yes.
forces us to choose, like, pick a few from these categories, pick a few from these,
Yeah.
ta-da, right?
Put people in boxes.
Yes. And in terms of like the eating disorder diagnoses we have available, they are so constrained, so limited,
Yes.
and unhelpful. So I really only believe in using a diagnosis if it's going to be empowering or help a treatment plan or be validating. From a PTSD standpoint, a traumatic event is a discrete event, right? That's what limits that diagnosis, where we feel profoundly unsafe, in a life-threatening situation, profoundly horrified or violated. It can be a violation of integrity, like in the case of a sexual trauma. But we know that in reality, the experience of trauma extends way, way beyond that, a discrete event. And
So is it the actual event or how you feel about the event? Because two different people can go through the same event, can't they?
yes, great. Yes, I see what you're saying. Yeah, so I think of um, our response to trauma as it's like a recovery process, right? We all humans will encounter experiences, curveballs in life,
Mm-hmm.
that sort of record scratching moments where our life changes very quickly, or losses, or other events that could be considered traumas, right? And all of us will. It's pretty much guaranteed as being a human, right? But
Yeah.
for many of us, our mind can find a way to sort of recover, right? We can find a way to sort of make sense of it and move through it. And I don't even know that recover is the right word, but to sort of like find a
Process
way.
it, I suppose.
Yeah, yes. When we see sort of challenges come up, it's sort of like when there's like the recovery doesn't happen, and there's sort of like we get stuck in that trauma state, right? Where we're extremely activated or disconnected, numb, or we've really absorbed changes in our thinking based on the trauma, like a lot of shame-based thinking. And I think that stuckness happens when we don't have the safety to recover, or we don't have enough support, or those traumatic stressors keep on happening. So I'm not sure if I answered your question, but I do think it speaks to the individual experience of their environment and their stressors.
Thank you for that answer. Yes, everybody responds in totally different ways. What sort of percentage of people with eating disorders do you think have a trauma history?
It's a great question. So what we know is that it is more than people who don't have eating disorders, right? So it's higher. Having an eating disorder increases your likelihood of having a trauma history. And we know that the more severe your eating disorder is, the increased likelihood of having increased trauma exposure. So some of our research has shown that when you get to those higher levels of care, like residential, where the eating disorder is severe and really requires a lot of support and attention, having an active diagnosis of PTSD rates are as high as 50%. And that's active, that's not by history. And we know that people underreport. So it's likely much greater than that.
You say that's a lot more than somebody in the general population. What would be this percentage in the general population, just so that we can look at
Yeah,
the difference?
I hope someone out there fact check me and let me know, but I believe it's less than 10%.
So that's a vast, vast
Yes.
difference then.
Mhm.
So, how does PTSD affect the course of an eating disorder?
That's a great question. So there's still a lot to be learned about sort of the chicken or the egg, sort of what came first. We know that exposure to trauma, particularly early on in development, it impacts our body in these really significant ways. It impacts our nervous system, our sense of connection and grounding. We're more likely to be sort of dissociated, or on that sort of dissociated spectrum, or dysregulated, right? And where we see the eating disorder come in is in an effort or in an attempt to sort of cope with, manage, or control a nervous system that has really been hijacked by not only the trauma exposure, but the lack of treatment in response to the trauma.
It's never just about the food.
Exactly. Exactly.
Yeah, so these conversations are so important because it really doesn't have very little at all to do with food. That's just a symptom. It's a coping mechanism for being unable to cope due to so many different factors.
Yes, it's so true. And what I think really revs my engine about this is I find like so many of the clients I've worked with over the years, especially those who've ended up coming to treatment, have faced so many stereotypes and judgments and misconceptions, including by therapists and medical providers who still are very stuck in a very outdated, incorrect idea of what an eating disorder is. No one asked them about their trauma history. It's the first time making those connections. And I think having an eating disorder can feel so crazy making, and it can feel so discouraging. And yes.
Totally. And I'm it breaks my heart that so many places still, particularly inpatient places, punish rather than encourage and love and create an unsafe place for an already traumatized person.
Yes, that's something I think our field needs to enhance. And I know there are strong efforts to do this, sort of really become sort of trauma informed places of care, and to really be assessing for each client, what is their history, what are likely to be their triggers, how can we increase a sense of safety and empowerment when treatment in and of itself is really hard.
Totally. I personally can't see how you can heal an eating disorder without understanding why it was there in the first place.
Yes, I completely agree. I completely agree. And it's interesting, when I was first training and working in this field, this is over 10 years ago, but how I was trained was, if you're aware that someone has a trauma history, don't talk about it, because it'll exacerbate the eating disorder. And our focus is get the eating disorder under control first, and then you can deal with trauma, family stuff. And it was really about just sort of like squashing the behaviors. And then these clients would sort of get a sense of stability, like, okay, this is under control, and then go back home to their triggers, to their stressful environments, need to cope and go back to what has worked. And you'd see clients coming back to treatment and feeling so discouraged, feeling like such a failure, right? And really, there's just not, the dots had not been connected in this field. And I feel like there's still a lot of work to do, and they're still being connected. But now we have a sense that if there's an experience of trauma, that really needs to be addressed. And we've seen that if you can do trauma work in the context of eating disorder treatment, the eating disorder symptoms will get better as the trauma symptoms get better.
Absolutely. I totally agree. Because just squashing the behaviors, treating the symptoms is just putting, what do you call them, band-aids
Yes.
over over a massive gaping hole, isn't it? It's not getting to the root of things. And of course, as soon as something else comes up, you're going to go back to using that coping mechanism because, well, it works for a start.
Yes. Yeah. That took me as a clinician, I think, a little bit of time to really understand that these behaviors are there for a reason. They serve a very real purpose, and they've, in many cases, helped someone get through. This has been the thing that has helped them survive or get through or feel some semblance of being in control. And so to just ask them just
100%.
to say, stop it. And I feel like that's the messaging so many individuals get, just stop it, don't do that, right? Like it's asking them to give up something that is their source of security. And so you have to provide something else to fill the gap before you can ask them to fully give something up.
Absolutely. And also to learn how to feel the things that you've been numbing out from trying not to feel for so long.
Huge.
That's really
Huge.
scary.
So scary, so threatening. Yeah.
Would you say certain populations are more vulnerable to eating disorders and PTSD?
Well, we know that people of color experience eating disorders at the same rate as Caucasian individuals. They are much less likely to be diagnosed, and they're much less likely to get the treatment they need, but they experience eating disorders at the same rate. However, they are much more likely to also have a trauma history, and so that will be sort of a bigger component of their eating disorder. We also know that the LGBTQIA population experiences high rates of that intersection of trauma and co-occurring eating disorders. The relationship with their body, sexuality, may have been a source of shame or stigmatization or harassment, discrimination. That adds another factor. And then we also know that the earlier one's eating disorders started, so when we see eating disorders that started in childhood, like 7, 8, 9, early adolescence, there's more likely to be trauma exposure compared to someone whose eating disorder started in late adolescence or adulthood.
That's really interesting. I guess that makes a lot of sense, actually, because, yeah, as a child, I mean, I started in anorexia at about 8 years old, and it was, I mean, it was nothing to do with how I looked. It was an attempt to stay small and unseen and therefore safer.
Yes, absolutely. Absolutely. Right. If we think about a child's capacity to put language to these things that are difficult to explain and understand, they're confusing and shaming, especially if there's not the safety in the environment to talk about them or share them or process, right? Behavior is going to be the way that we will cope, right? And I've heard from so many clients over the years, similarly, just a desire to be small, to not be seen. Even I think for some, having access to treatment has been a source of safety. Treatment is sort of the safe place. It's a place where you get
Yes.
care and attention, and needs met in a way that may not happen in a invalidating or unsafe childhood environment. And then I've also had clients who eating disorder manifests with binging, who've described just wanting to feel or present their body as something asexual, something that won't be looked at, and the eating disorder sort of fuels that. It's another sort of way of processing the trauma.
That's really interesting. Thank you so much for sharing that. And it makes so much sense. Also, in my own story, I found that once I'd started restricting, that restricted my ability to feel, which was incredibly helpful to me at the time. And I've got several clients that have had very similar experiences. And to me, the eating disorder got me through a time where I had no other way of coping.
I really appreciate you sharing that. And it's so that again and again and again. And I think it's a very big misconception of sort of what drives an eating disorder. There continues to be the stereotype that there's sort of it starts with a diet gone too far, a desire to lose weight, right? And for some that may be sort of the opening way into
really small amount of people.
Yes, I agree. I probably, I mean, I can't think of it. I'm sure I could, but I can't think of anyone off the bat that their eating disorder started that way. And I think the other thing is I hear a lot when I'm like in my neighborhood or introducing myself to someone and telling them what I do, like, oh, I could never have an eating disorder. I get so hangry, like I'd be too hungry. And this idea that because you restrict, you're hungry all the time. I'm like, no, it's numb. It's a numb, it becomes, it's disconnection. And that is the like that, it's giving you something that you need because if you were to sit with the feelings and the realities of the context, it would be too painful and overwhelming to process. Um, it makes a lot of sense.
Yeah, absolutely. Totally numbs out. You have no connection with your body. Those feelings of hunger and stuff, for a lot of people, certainly for me, they were gone. They just weren't
Yes,
there.
yes, yes, totally. And then so it makes it easier for the eating disorder to gain strength. But I think the other thing that I'm curious if you found this with your clients, that many of my clients, when they're in their eating disorder, they do other things that are a source of shame to them, like shoplifting, or they lose relationships. And it's not only they're disconnected from their hunger cues, they're disconnected from their values, they're disconnected from their inner voice, their intuition, right? You're sort of flying blind, and you're just disconnected from yourself in really big ways.
Yes, yeah, I agree. I think there's a lot of like comorbid behaviors with eating disorders, and there's so much shame in general. So much. I would lie a lot, hoard food and hide it, even though I had no intention of eating it. Um, it just felt safe to have it there.
Yes, yeah, that makes sense.
And perfectionism, people pleasing, constantly being incredibly negative to myself, and just like all the things really.
Yeah, yeah. It's true. I'm glad you brought up people pleasing, because I sort of see that as its own behavior. Like it provides a sense of control. Like if I can only just do everything right, then I'll
Yes,
be okay, right? It's like restricting, like exercise, it sort of gives a sense of security.
yes, it does. And I think part of the restriction with the eating disorder, and this could very well be related to trauma, is something that somebody can do really well.
Yes.
And it gives them a feeling of almost superiority. Other people have to eat to survive.
Right. Yes, yes. Yeah, yes, it's very true. It's something to feel proud of. And I think that sort of like that, what you're talking about, like the perfectionism, like into restriction, it's
Yes.
reinforced, especially with women. Like you're given so much praise for being disciplined
Yeah.
and good and a rule follower. And yeah, so many of my clients have sort of beliefs like it's not about changing their body or trying to be thinner. It's like I did it yesterday. I should be able to do it today. I didn't eat until noon. Today I have to do the same thing, right? I have to sort of push my body. Other people need breakfast. I don't need breakfast. Sort of like being able to do more or push your body in
Yes.
your way.
Yeah. And to move more, to be on the
Yes,
go more. And it's like you failed at everything else in your life, but this is the only thing and the one thing that you can actually get right, that you can
right.
do really well. All these other people all around you are going, oh, how are you so good to not have that cake?
Mhm.
How are you so good to not give in and eat? How can you fast for so long, or whatever it is that they're saying? So you feel like you really have a superpower, like you can do something right that very few people can do. And you've been trying to find something that you can do right
Right.
for so
Yeah.
long.
Yes, totally. Yep. Yep. It's spot on.
So, is there a specific way that you would treat eating disorders when there is PTSD present?
Well, I would start. I think it's really important for any clinician or any provider who's meeting someone either with an eating disorder or trauma and is not sure what else is going on, is to assess for both.
Yes.
Um, I find like a lot of clinicians in the mental health field sort of feel like eating disorders, like, oh, I don't do eating disorders. And
It's from fear, isn't it? Because it makes no
yes,
logical sense
right.
whatsoever.
Yes, I know. I know. And so questions don't get asked. And sometimes I get referrals, from providers that's like I was seeing with someone for trauma, but then like I found out a year later that they purge. And it's like that the questions were never asked. So asking directly about everything. I really believe in getting a full trauma history right off the bat, especially asking directly about sexual trauma, which can be really hard to speak about. And asking about your relationship with your body, your relationship with food. I sometimes ask if I were to watch you eat for a couple of days, like, what do you think I would notice? If that feels like a little bit of more of a warm up than asking directly about behaviors, but really getting a sense of sort of what's going on and providing, I find for people with eating disorders, like education can be so helpful, letting them know, like, wow, it makes so much sense that you've been struggling with these behaviors. Look at all you've been holding. You
Yes.
experienced the sexual trauma and it never got addressed. Like, of course you want to feel in control, and you can sort of see the relief. Because I find, as I said, like so many individuals with eating disorders, they feel messed up. They feel crazy, that there's something broken or wrong about them that's reinforced by other people in their lives. And so to be able to say, like, of course you're doing this, of course, like this makes total sense, and providing some education can be really helpful. And then depending on the person and where they are, if they're willing, starting trauma work, even if there's still eating disorder behaviors going on, I think can be a really, really helpful approach. And it also can give them the relief, like, I'm not going to ask you to give up these behaviors right away. Let's try this and see if things feel a little bit more flexible, a little bit lighter, and then we can tackle what's left of the eating disorder. That's sort of like my dream approach if I can do it.
With that, is it possible if somebody is in severe restriction, do they have the cognitive capacity to start doing trauma work?
I will always want to try. And this really came from my own sort of clinical regrets of doing things sequentially, even telling people, no, we're not going to talk about your trauma right now, sort of not even letting them process it, when they were in treatment, right? And in intensive treatment, if you have enough support, if you have a team, a dietitian, maybe a coach, like someone who can just make sure everything's fully supportive, certainly like higher levels of care. I really prefer to, like, let's start tackling the trauma, because if we can get sort of the activation down or help someone feel more connected with their body, which is a lot of trauma work. It's grounding, it's safety. We don't even have to talk about the trauma. We can start with those other sort of skills. It, I think, makes the eating disorder work harder. Otherwise, those triggers will keep exacerbating the eating disorder.
Thank you. Yeah, I agree. The reason I asked is because so many providers will only treat the behaviors first and then start looking at doing all the psychological work.
Yeah, I know. I don't know how radical this sounds. I'm looking at data and I'm bringing in my personal experience. I think working with someone new, asking them to give up the eating disorder right off the bat is a tough ask. And it's, I don't know, I think trust is earned and a therapeutic alliance develops over
Absolutely.
time, right?
Yes.
And so unless someone is medically at risk, I personally am okay of, let's just keep honest, open lines of communication. I want to know what's going on, but let's see if this might work with specific types of trauma. I think it can be helpful to tackle the trauma first, and especially with individuals who've been through a lot of treatment and they have some of that treatment fatigue, to say, let's focus on a different angle here, I think can be helpful.
Yeah, I actually have clients who have trauma from treatment.
Yes, yeah, I can understand. Yeah, no, I've heard that too.
Mm.
Yeah.
Well, thank you so much for sharing all that information with us. This is amazing, and super, super helpful. And I really hope that people listening to this will realize that they're not broken, that having an eating disorder doesn't mean that you're crazy or mad. It's a way of coping, and there is help available. You might have to look for it, but
Yes.
it's available.
Yes. Yeah. If I could go back to one of your first questions and have a second magic wand wish, it would be to put that in the brain of everyone with an eating disorder.
Yeah.
There's nothing wrong with you. This actually makes a lot of sense. And unfortunately, you didn't get your needs met. You weren't treated the way you deserve, and you haven't gotten the support that you needed. And so if I could combine my first two wishes, the access to mental health care and that knowledge, like find someone who can help you.
Yes, absolutely, because you do deserve the help, and any of the stuff that's happened to you, it's not your fault.
Right.
And using what are now maladaptive behaviors, but then quite possibly were the only things that got you through. Of course you did. You needed something, and you didn't have anything else available to you at the time. We will always do the best with what we've got available to us at the time.
Exactly. Yeah, exactly. Sometimes with clients, I talk about sort of expressing gratitude for the eating disorder and saying, thank you so much for getting me through that. I appreciate you trying to protect me, and I'm ready to let you go. I don't need you anymore because I'm safe now, but I
Yeah,
recognize there was a time where I did need you.
absolutely. Yeah, because it's helpful until it's not, really.
Exactly.
Yeah. Well, thank you so much. Is there anything else you would like to share with the listeners?
No, this has been a wonderful conversation. Thank you for having me.
Oh, that's wonderful. And I will put information and your website in the show notes. And you've got a trauma workbook as well that people can look at, haven't you?
Yes, it's called Learning to Thrive. It's based on acceptance and commitment therapy, or ACT. It's a self-help book, so you can take it at home and work through it.
Oh, awesome. And is that like just available at Maze booksellers and stuff?
Yes, yep, you can get it online.
Awesome. Well, I'll put a link for that in the show notes as well. Thank you so, so much for being a wonderful guest. And thank you, listeners, for being here again. I'm so grateful for you. And until next week, take care and look after yourself with love and compassion.